Hello friends, I am Dr. Dilip S. Rajpal. I am a general and laparoscopic surgeon. I specialize in single incision laparoscopic surgery. First of all, coming to before single incision laparoscopic surgery, what is laparoscopic surgery? Laparoscopic surgery is a minimal invasive surgery in which surgery is done exclusively through minimal holes in the abdomen, ranging from 0.5 to 1 centimeter. Typically, around 3 to 4 holes are made. In any laparoscopic surgery, we need minimum 3 holes, since we need to put one camera which is connected to TV for visualization of what is going inside the abdominal cavity. Second will be to hold the tissue, and third will be to cut the tissue. Now we specialize something called single incision laparoscopy. So this is a new advanced minimal invasive surgery in which instead of 3 holes or 4 holes, we do exclude this complete surgery in a single hole, and that too typically from the patient's navel. Now who does this particular surgery? So this is advanced surgery. It requires a long learn. It has its own long learning curve. So because it's advanced surgery, so the surgeon who is doing it should have a expertise about the laparoscopic surgery. So that is the main indication. This thing. Now what all surgeries can be done? In today's the most common surgery what can be offered is single in Sill's cholecystectomy. What we call as Sill's, a single incision laparoscopy. Sill's cholecystectomy is gallbladder stone disease. That is the most commonest of the surgeries. Of course, indication wise, we do Sill's appendectomy, we do Sill's diagnostic laparoscopy, Sill's mesenteric lymph node biopsy. In best of the centers, it is done for any disease, including that of bariatric surgeries also. In today's what is the main advantage of this particular surgery is that there are single hole in the navel, and so that definitely that causes the size is hardly 2 centimeters, because we take inverted stitches. There is a patient gets a waterproof dressing, so patient has a feeling that he has never been operated. So psychologically patient doesn't have any pain per se, and because there is a single hole, obviously the chances of complication, wound infection, herniation, everything is very low. We use all normal conventional instruments. In conventional instruments, here again there are two parts. One is either using conventional instruments or using something called Sill's port. Sill's port is a disposable port which is slightly expensive, which costs around 20,000 rupees per patient. Now we are doing by conventional surgery, in which we use the normal conventional instruments. So there is no extra cost burden to the patient. So with the same common instruments, we can complete the surgery. So definitely the cost part also doesn't increase for the patient. So in the same cost, patient gets an added advantage of less scar. Now it has its own disadvantages in the sense the instruments manipulation is become very difficult. It has its own long learning curve, because we were always taught that the instrument angulation has to be 90 degrees and azimuth angle and all those things we were always taught. But here all the principles are gone. Now we are actually all the instruments are going parallel to each other. So when we are doing the surgery, all the instruments are fighting and cross fighting with all the instruments. So it has its own learning curve. That is the thing. But in today's date, with in 8 years of experience, we have started with simple cholecystectomy, simple gallbladder diseases, and we reached the stage of acute appendix. And now in today's we even manage pus in the gallbladder, empyema, mucosal of the gallbladder, appendicular abscess, even gangrenes of the appendix and gallbladder, that can be managed single. There is no restriction. We put in a single hole for all. We offer Sill's surgery for all our patients. We do our own modification, as I already said, that is we use all normal conventional instruments. We don't use any special instruments, so it definitely doesn't increase any cost burden to the patient. So the main nutshell is that Sill's is advanced laparoscopic surgery, and which causes very little pain, better cosmesis because small scar is there. We usually do subcuticular stitches, so patient's scar is hardly visible. No need for any suture removal. We give waterproof dressing, so next day patient is back to normal activity. We usually hospitalize for 36 hours. In 48 hours, patient is back to normal activities. So for any such more videos, you can connect to Elaborate page, and thank you.